Morning, my name is Clay Adams. I'm the Vice President of Communications for Vancouver Coastal Health, and I'm just essentially going to moderate, shall we say, the news event this morning and assist you in getting what you all need to continue the coverage of what's a very important story for us and quite a historic occasion. Before I run through actually the format and introduce the people at the head table, I just actually want to say it was a little ironic because we have a very historic occasion today, and I thought that was, certainly I know Patricia and Dr. Montana would remember this. It was essentially 8 years ago, plus a couple of weeks, that I was actually here to play this very same role to actually unveil what was and announce the opening of North America's first supervised injection site. So 8 years later, we're here on a again, positive note, and that personally and on behalf of the organisation is a delight to be able to do. The format for today, we have representatives of 3 of the partner organisations in Insite at the table who will take questions, and I'll just introduce them left to right. We have Liz Evans, who's the Executive Director of the Portland Hotel Society. They're obviously a key partner in Insite and provide services to support the users of this facility. We have next to her Dr. Patricia Daly, who is the Chief Medical Health Officer for Vancouver Coastal Health, of course, the owner-operator of Insite and the holder of the exemption. And thirdly, we have Dr. Julio Montana, the Director of the BC Centre for Excellence in HIV/AIDS, the world-renowned research body whose findings have demonstrated over the years the value Insite has brought to the population it serves. Also on the table is Dr. Thomas Kerr. Dr. Thomas Kerr is Associate Professor at the UBC Faculty of Medicine and the scientist who has been overseeing the evaluation of Insite for the BC Centre for Excellence in HIV/AIDS. Thomas will not actually make any remarks during the initial part of the conference, but we'll be more than happy to take questions as they come, and I'm sure there will be questions. Each will provide a brief response to today's Supreme Court ruling from the perspective of their own organisation. We'll then open up the floor to questions for several minutes. Please keep in mind and understand that we do, of course, now, thankfully, continue to have a legally operating injection site which does need to open its doors in about 90 minutes. So we obviously have to make the facility ready and have you all out of here for that to occur. We have phone lines that are open to media and other listeners right now. Unfortunately, we cannot take questions over the phone, so I apologise to those who are listening. But those on the phone, the media in particular, if you have questions or need to get some follow-up support, please contact us through the communication lines and we will make sure that we follow up for you. So on that note, this is the final thing also. You'll notice we also have representatives of many of the other partner organisations, both behind the speaker table, in the room. We have clients, we have legal representatives of our organisations, we have other interested stakeholders, all of who, while not part of the official process right now, I'm sure will be more than happy to speak with you as well as you need to. Again, we're more than prepared to facilitate those discussions afterward. So on that note, I will hand you over now to speak first to Dr. Patricia Daly.
Thank you, Clay, and thank you everyone for being here on this historic day. On behalf of Vancouver Coastal Health, we're thrilled by the Supreme Court decision, which now gives us a legal mandate to continue to operate Insite to provide the health services that we know are so vitally needed to this vulnerable population here in Vancouver. And we hope that this ends the legal battle and that, in fact, we won't have to hold another news conference like this on this site. It will just continue to do its good work on a daily basis. I would like to thank some people. First of all, I want to remind you that the court case was brought forward by 2 clients of Insite and by the Vancouver Area Network of Drug Users who do good work in this community, and we'd like to thank them for doing so. Insite has operated for 8 years because of the incredible work of our partners, the Portland Hotel Society, the BC Centre for Excellence in HIV/AIDS, who've undertaken the research which has demonstrated the benefits of Insite, but also because of the support of our provincial government, the City of Vancouver, the local community, the Vancouver Police. We could not have achieved the successes we have without that local support. And I'd like to remind you that Vancouver Coastal Health is committed to reducing the harms associated with all addictions, whether those are addictions to legal substances like tobacco or alcohol, prescription drugs, or illegal substances. Addiction is a medical issue. We're committed to preventing young people from becoming addicts. We're committed to treating those who may be addicted to these substances, but at the same time, we're committed to reducing the harms associated with drug use as we engage users in treatment. And harm reduction goes hand in hand with treatment. It's not either or. You can't invest in drug treatment without providing harm reduction. Harm reduction has saved lives, prevented overdose deaths, prevented people from becoming infected with life-threatening infections, and has also provided a way for us to engage a very marginalized population in drug treatment, some of which is provided right here upstairs at Insite, our detox facility. And we'll continue the good work here with our doctors, our nurses, our counselors, the support staff from Portland Hotel Society, as long as there is a need here in this community. I'd like to